So my name is Jeff Weitz. I'm a professor of medicine and biochemistry at McMaster University, and I'm the executive director of the Thrombosis and Atherosclerosis Research Institute, which is a joint venture of the university and Hamilton Health Sciences, the major hospital in Hamilton, Canada. And my job is about 75% research, and the remainder of my time is split between clinical work. My practice is focused on patients with thrombosis. I deal with patients who have complicated forms of arterial or venous thrombosis. And my educational activities focus on undergraduate medical education and postgraduate medical education, and also on education of non-clinicians, undergraduate, graduate students in biochemistry, medical sciences, and bioengineering. This 6th edition of Hematology is really a big deal because this book is a foundation text for medical students, for trainees in internal medicine, and for trainees in hematology. And not necessarily just for clinicians, it's also for basic scientists in this area. So this book is great because it gives everything from the basic concepts behind mechanisms of disease to the disease itself and how you manage it. And it's written in a way that anybody at any level of training can pick it up and get something out of it. So what I like about it is that you can get an in-depth look, or you can get just pick and choose the aspects you want to learn about a topic of interest. And for me, as I said before, it's difficult to keep up in everything, so if I want to get a quick review of an area that I haven't looked at for several years, I can pick this chapter up and look at that and again refresh my memory about what's happening, how things have changed. So this is an important textbook, and it's one of the most popular textbooks of hematology. There's lots of textbooks out there, but this one is a very popular text amongst learners and practitioners alike. It provides you with a full-service look from mechanisms to management of disease, and it covers all aspects of hematology. And even in the sections that I was involved with, tried to expand it, this edition over previous editions, to go beyond just the traditional thrombosis and hemostasis, but also to bring in aspects of vascular medicine. So what's happening with stroke, what's happening with coronary artery disease, what's happening with peripheral arterial disease, and how is the management of these disorders evolving. For stroke, we've gone from lytic therapy, where we use clot-busting drugs to open up the arteries, to interventions to extract the clots. In the heart, of course, interventions are the key, and in the legs, also to interventions. So we have chapters that are new to this edition, chapters on stroke, chapters on interventions for all kinds of vascular diseases, whether it's clots in the leg, clots in the lung, and how do we manage patients with coronary artery disease from the hematology perspective. So not from the cardiologist perspective, because the cardiologists prescribe all these medications, but when they run into trouble, who do they call? They call the hematologist to bail them out, and you find out that they're on maybe 3 different drugs that inhibit platelets and an anticoagulant, and then they put a hole in a vessel in the groin, and they wonder, why is the patient bleeding, and how do you manage that? So these are things that as hematologists we're faced with, and now the book is addressing that and giving you ideas about what's going on there and how to manage these complicated cases.